Hey, it's Dr. Dunaway with Chiro Strength, coming to you with a 3-part video series on the foundations of recovering after giving birth. The strengthening and the mobility routines for each individual will be different depending on level of activities prior and a host of different reasons. So this is not geared towards making you strong. This is geared towards laying the foundation so when you recover enough to be able to move and lift again, you will be able to do so with less risk of re-injury and starting to create a little more symmetry in the body to set you up to succeed and not hurt yourself so you can be there for your child and not have to worry about being in pain or injury as you're trying to raise your child, right? So this is going to be the first thing we talk about is the breathing, and is going to be reestablishing good diaphragm activity so you can help support the torso and pelvic floor with good diaphragm mechanics. And all I'm going to need is a belt. I got a little TheraTube here, and I'm going to do this lying on my back with this tube just wrapped around my waist. This gives me a little tactile sensation all around the belly because when I breathe, I'm going to want to expand this, this belt or this tube as I'm taking good slow breaths. So the first thing we want to do is get in good posture. A good posture, I tell people to cough, and if you get a little cough, you'll feel these ribs come down, and you're just going to hold that posture right there, and then try and take a good slow 3-second inhale, initiating that inhale with the belly, trying to keep the chest elevation to a minimum, and then exhale. And the more you do this, bring your attention to the band and really feel that band expand in 360 degrees, not just up, but out and down into the table as well. So again, this drill is going to be cough and hold to get those ribs down and the spine in a good position. And just slowly work 15 to 20 breaths of good slow breathing patterns. Now as you start to recover a little bit, and it gets a little further out from the delivery date, and you can bear a little load. Now, I don't have a baby, but I got a 10-pound kettlebell. And so you can hold your baby above you because this little added pressure will help engage the torso a little more. And you can just play with the baby and breathe and use the baby's weight as an extra external force to increase the abdominal contraction and further improve the coordination of that diaphragm as you breathe. This has to be a daily practice. Taking good even 5 minutes a day to retrain the diaphragm to breathe properly is going to be key into successful recovery long-term from pregnancy. So that's why this is the first video. Foundational from a standpoint of recovery. Get that breathing retrained, and then we'll move forward with a couple other drills in the following videos. So again, this is Dr. Dunaway with Chiro Strength saying don't just mend, transcend. Thanks.